I'd like to ask Dr. Finegan and Dr. Yule, notwithstanding what they have said already, are there any circumstances whatsoever that they feel assisted dying could and should be allowed? Is there anything that's there?
Thanks, Senator. So in terms of any circumstances, I think in every case of consensual medical self-killing, you have a circumstance where the patient's life is treated as a means to an end, that the life is extinguished as a way of ending some sort of condition or suffering or so forth. And I think that is always necessarily contrary to respecting that person and their life as valuable. So my answer to that would be no, in principle grounds. That's obviously distinct from the question of, within the idea that it's permissible, is there the germ of an orientation towards expansion? There is. I think that's really clear when one tests it. But just in principle, even in limited case, it always involves treating that person as a means to an end. It always involves rejecting ultimately that their life is of intrinsic, equal, inviolable worth. So I think the compassionate and just and moral thing to do in that circumstance is to do as best as one can to alleviate their suffering without killing them.